Welcome everyone to our fourth webinar. We'll get going here in just a moment. Look forward to chatting with everyone at the end with our Q&A. It's going to be a good topic. It's one that I've used many times throughout the years, and after digging into the limited research that combines these two things, I'm glad I did. It seems like the perfect combination. Okay, so let's dive right in. Welcome to our fourth webinar. This is our biggest audience yet. We seem to double every time. We're in our beautiful studio again. And as I just mentioned, this is a topic that is dear to my heart because it's one that I had a lot of success with, helping the people I work with, combining these two therapies. So if we dive right in, our mission at Spidertech stayed consistent. We want to provide the highest quality product, the most reliable product, to help all of our therapists essentially give the best quality treatment to their clients. The place I've had the most success, or where I started using the cupping with Spidertech was with my tennis athletes. The decompression of the cupping was really important to me after they finished their matches, and I wanted to get the most out of that. But I was a little concerned about causing tissue damage that would affect them playing tennis the next day. I used this the most usually was in the bigger tournaments in the Grand Slams where they had a day off in between their matches. But if a long hard match happened and they had to play the next day, I would still do this. And so I would use a Spidertech after the cupping, with the hope that we can eliminate any of the potential detriments from the superficial blood flow, capillary kind of breaking from the cupping. And I may have been a little too sensitive on that, but I wanted to make sure there was no detriment. It was all positive. But we really wanted to maximize the decompression to get that fluid out of the area. So it's something that I've used a lot. I'll go cupping after a match and then tape through the night. And it's something that I was quite successful with. So that'll lead us right into our webinar today. We're keeping it simple as we always do. We're gonna understand how combining Spidertech with cupping affects healing. And then we're also going to go over how you would apply the kinesiology tape to Spidertech after you finish your cupping to maximize your results. To understand our product, because we make the highest quality kinesiology tape you can get, all of these things come with it. So it ends up being standardized. It's simplified, it's long-lasting, reproducible, time-saving, and you can apply it in the office, at home, really anywhere you want, and each application will continue to be consistent throughout wherever you apply it. So because we have the quality, then you end up getting all these benefits. If we dive right into the heart of this presentation and the webinar, this is really one of the only research papers that is out there looking at the results of kinesiology tape and cupping. In this paper, they look at ladies in their third trimester, so fluid retention and swelling and is an issue, and as a result, we end up with higher than usual carpal tunnel issues with pregnant women in the third trimester. And so usually, depending on where you are, you're looking at kind of 30 to 40% of women during their third trimester will have symptoms of carpal tunnel. And the important thing from there is 50% of women or about there will end up with carpal tunnel even after the pregnancy is finished. And so we need to get at this. We need to make sure that as therapists, we need to make sure that we can squash this. So after postpartum is a much more healthier, happier place for our patients. So this study took 1 month. They did it for 4 weeks. They did 2 groups. The first group had kinesiology tape. The second group had cupping. So the kinesiology tape group, they went 3 days on, 1 day off, allowing the skin to heal in between. And the cupping group did 2 treatments of cupping in every week for 4 weeks. And the treatments were 5 minutes of cupping right over top of the carpal tunnel, and then 2 minutes of cupping with movement up into the forearm. And I'll mention this is a study from 2023, so it is fairly hot off the presses. So if we look at the cupping that they used, if we go back a little bit there, guys, yeah, perfect. So we're here. This is the cupping. One more slide over, guys. There we go. So this is the cupping technique that they used. The pressure that they used, the suction that they used was 50 millimeters mercury, and that was the suction that they decided as a kind of a standardized way of treating it. And as I mentioned, they went 5 minutes right over top of the carpal tunnel, over top of that transverse carpal ligament or the flexor retinaculum, and then also they did some cupping with motion up and through the forearm. And this was done twice a week. If we take a look at our carpal tunnel, you can see how, just as a reminder, how that retinaculum or the ligament there will have significant impact on our median nerve as it gets squashed in between our flexor ligaments and, our flexor tendons, and that in this picture they use ligament, but that is interchangeable with our retinaculum. And so if you can appreciate with how tight and kind of secure of an area that is, if you add in a bunch of fluid, then all of a sudden we're going to get some compression in through that median nerve. So I'll go over, this is purely what the study listed as what the benefits of cupping. And so these are the things that, the ways that they explained having great benefits from cupping. And I think that the interesting thing about this, well, a couple interesting things, but one of them is decompression is the mechanism why this works. You get all these benefits, including blood circulation, because of the decompression, the suction, the pulling up on the tissue that the cupping provides. There might also be some actually kind of pulling up on the ligament, on the retinaculum as well. So you might actually be able to, with the cupping, kind of get in there and pull up. But again, that goes back to our decompression idea and pulling upwards. For the population that we're working with, these are pregnant ladies. That's why we're not going to be using any medication. We're not going to really kind of any aggressive treatment, like surgery or things like that, really out of the question at this point. We really need to be in the realm of the kind of non-invasive safe therapies, which both cupping and kinesiology tape do very well in. This is the benefits that the research paper lists and the mechanism of, the benefits that kinesiology tape has. It's quite extensive. I mean, we're transforming soft tissue, we're enhancing flexibility, we're looking at the discharging of lymph, reducing the swelling, edema in the area, we're boosting circulation, we're able to reactivate and kind of retrain muscles, we're getting rid of kind of any muscle tension that comes from a pathology or disease. We're improving the proprioception of the area, and then we're also able to decrease pain by the rubbing on the skin from the sensor gating. So that's a whole mouthful. There's a lot of things that are kind of thrown in there, but it comes down to the same mechanism of action, It comes down to the tape is on your skin, it's lifting up, it's providing constant feedback, constant information through the mechanoreceptors in your skin to your brain. And all of these great benefits are possible because of decompression, because the tape has elastic property, retracts back on itself, and elevates the skin. Exact same mechanism that we've talked about the cupping. So these two things are one and the same, and they're also non-invasive. The difference is, and we'll see, that cupping has much more decompressive property, which is great. In my mind, it's the sprint where the Spidertech is the long distance run. The cupping gets more of a decompression than the tape does, but the tape is on there for a greater length of time. So if we dive into our outcomes here, the first one we'll look at is our visual analog scale. This is where the people in the study will rate their pain before and after. And on average, the pain rating when they went into the study was in the range of 7 out of 10. And then on average, for both the kinesiology tape and the cupping, it was in the 2s. So as you can see, there's a 5.1 point difference for taping and a 5.6% difference for cupping. So they both did fantastic. I think it's also important to remember too that the chances of these ladies getting better is very slim, because as the pregnancy goes on, you would expect more fluid retention, you would expect more fluid in the area. So the fact that we were able to have a 5-point difference and even a little bit more than that on the VAS is, I think, very significant, very impactful for these ladies during their pregnancy. Our second column, we look at symptom severity. This was on the Boston questionnaire for carpal tunnel. So the first part for this scale is things like, when do you have pain? Is it during the day? Is it at night? Is it numbness? Is it tingling? Things like that. So it looks at the severity of our injuries. And as you can see, again, we have the tape with a huge decrease, which there mentions increase, but that should be 74% decrease. And then with our cupping being our 92% decrease in our numbers. So again, huge benefits for the carpal tunnel issues. And then the last piece is our functional tests, like can you put on a button, can you lift things, can you grip, can so on. Kind of asking about your activities of daily living. And again, we have, from just using tape, we have a 60% improvement. From cupping, we have a 92% improvement. So these are massive improvements for these ladies with carpal tunnel. And lastly, they looked at, can you go back one slide, guys? Lastly, we looked at the median nerve cross-section at the piezoform level, because one common thing with nerve diameter, with nerve kind of responding to irritation, is it gets bigger. As it deals with inflammation, as it deals with injury, the nerve gets larger. And so with taping, we took the median nerve at the piezoform level down from 14 millimeters, and then with taping down to 8 millimeters, with cupping from 14 down to 7 millimeters. So we're looking at in the range of about a 60% improvement with both taping and cupping. Cupping was a little bit better, it was at 68%. But essentially, again, like we have not only the subjective, how are you feeling, rate your pain type benefits, but we can also see through ultrasound the changes in the nerve that occur because the therapies are being used, both the taping and the cupping. And so before we jump into the next study, I think the takeaways from that is, as therapists, we have limited time with our clients. Whether it's 15 minutes, half an hour, 1 hour, we have to choose what we do. We have to choose what we decide to kind of provide to the client to get the best results. Both therapy saw huge improvements. And the exciting thing is that we don't have to choose one. We can do both of them. I mean, that could be a great research paper, is if we were combining the two of them together instead of just the single comparative back and forth. And so I think that's something to consider. The cupping takes a little bit longer. We saw the results were a little greater. We could then finish our treatment with applying kinesiology tape. It would be on there between our treatments. So in the case of the study, instead of going 2 treatments and then nothing in between, you could have gone treatment with cupping, tape, and then treatment with cupping, and then tape. And then you could have continued the therapeutic benefit the entire length of the treatment, of the study. And so that's what I would recommend you do with your clients. It's where I got my great results helping tennis players. I think that's something to really consider. And also as a therapist, we get so focused on what the time we spend with them. When the last thing you do with someone is put tape and then they kind of go away, like they're gone for a couple days or a week, whatever it is, we lose track of the fact that we did something with them with Spidertech where they continued to see benefit the entire time that the in between treatments. So I also wanted to, if we kind of switch gears a little bit here, I wanted to look at, we talked about decompression, and this is a perfect study that looked at just how much decompression we can expect with our taping. This is a 2020 article. Again, they use ultrasound to see the differences in the elevation of with and without tape. And it kind of shows exactly what we can expect benefit-wise. So here's a picture from the article where they're looking at the space in between the skin and the kind of the superficial layers of fascia. Then you would get down lower to the deep layers, and then also you get down into where the muscle is. And what we see there is an increase in that interstitial space, the space just underneath that skin, because the tape was on there, it retracted back, it lifted up, and all of a sudden we get some decompression between those structures and the skin. The interesting thing, and the way that we know it's reproducible, is that connecting to the skin and the lymphatic vessels are these anchoring filaments. They make it so then when we pull the skin up, that we know that the lymphatic vessels are gonna go up with it, and so we can be confident that our treatment is going to be successful. We're not just hoping that those lymphatic vessels open up. We can be confident that they're gonna elevate and raise with our skin as a result of the tape being on there. We kind of see a similar bigger picture image here, and I think this is a good place to say that we can see how the tape being on there creates these crests and these troughs where the tape is lifting up. We know that the cupping doesn't do damage to the muscle, so it's not like a normal bruise. It's just from those kind of superficial capillaries in through the skin. But I still think if we get the tape on there afterwards, we can help get rid of any of the blood that's in the area. We can kind of speed up and get to the kind of the maximum benefit and make sure there's no kind of stagnation of blood in through the area where the cupping was beforehand. And as a result of that, if there is any kind of reaction with the body to sensitize the nerves sensors at that area, if there's any kind of chemicals being sent by the immune system to kind of like to clean up that area where the blood is underneath the skin, then I think that we can kind of get rid of that as quickly as possible. There also is the point where the cupping was used for a reason. It probably was used for a very good reason, and the same reason is the same. It also is the same reason that you would use the tape. So I think once the cupping's finished, if we put kinesiology tape on there afterwards, we're continuing the therapeutic benefit on whatever your reason for providing the cupping was in that particular area. If we jump back to the study, what we saw is with the tape being on there, we have an 11% increase in our in that space between the skin and the superficial layer of fascia. And then after 24 hours, we saw a 16% increase in the space. So reliably, we know that we're going to get some increased elevation from our tape. So we're going to go through a video here of the low back pro cut that we have. And the reason is that I think it does a great job of looking at how the tape is able to kind of pull up on the skin to provide some decompression to the tissue below. And so you can really kind of visualize the benefit the tape can have there. So if we jump into our YouTube video, so this is online for everyone to see when you're applying the low back pro cut. There we go. So this is our YouTube video. When we're applying the tape over top of any of the area of the body that you're using, we're going to make sure that you're stretching the skin, the muscle of that area. And that's to make sure that as we go through our normal range of motion throughout the day after the tape is on, that the tape is never going to restrict any range. So for the back in this situation, we're going to roll the low back forward as far as we can in deflection to make sure that if you go through your day and we're touching the toes, that the tape doesn't get pulled beyond its elastic ability, which is about 40% further than it sits. So you can see here that we applied the base, that number 1 strip. We now use the numbering system to see exactly which strip to apply next. We apply it up onto the skin, and for the purposes here, we're going to apply and attempt to do it with no tension. So you can see here, I'm not dragging the tape up the skin. I'm taking the tension out of the tape and applying it that way. For our low back pro cut, we're going to go up the erectors on either side of the spine, and then the number 3 strips, they go up over top of the thoracolumbar fascia and through the low back, kind of tracing over top of the lats on either side of the body, going up towards the shoulder on that same side. And then right here, you can see how that tape grips the skin, it yanks it up back, and it really gets that decompression that we want. It gets that space between the skin and the fascia to open up. It pries open those lymphatic vessels. And so that's where we're getting the benefit in terms of kind of fluid movement from the tape. So you can imagine if you had just finished your cupping treatment in the low back, you would put this right over top of the areas that you did the cupping. I would assume most times you're going to do it right where the tape would be, but you could, if we're doing it right over top of cupping, you can move the strips exactly where it needs to go to kind of cover those the marks that are left from the cupping to make sure that we get maximum therapeutic value for the times between our treatments. And you can see right here that the tape certainly doesn't impair any range of motion. It doesn't impair anything, and it'll actually provide the brain more information about the spot that it's on. We get that proprioceptive awareness through the stimulation of those mechanoreceptors and the proprioceptors in through the skin, and so that we get not only we ensure that that from the cupping that the results aren't kind of muffled from the tissue damage or the skin damage. We also get the opposite, and we can kind of maximize the proprioceptive awareness. All right. So that concludes. Except I want to show the way that I would apply our fan pro cut. 4-year ladies with carpal tunnel. If we're going back to our first study and we're looking at how would we apply the tape to maximize our benefits for carpal tunnel and third trimester, I would use our fan ProCut. And normally you would apply with the number 1 tab at kind of the proximal end and always kind of go downwards. But I like to flip that a little bit around for carpal tunnel because there's so much motion at the wrist, because there's so much, and it kind of takes a little more wear and tear through the hand. I'll actually flip that around and I'll go the opposite way. So I'll actually kind of apply it at the forearm that way. So I'm going to snap and break each one of the perforations first. I'm going to apply the base right over top of the carpal tunnel. And just like so. And then I'm going to, from here, I'm going to bias up towards you see there, I'm going to stretch my wrist to make sure that the tissue that I'm applying the tape to is stretched. And then we're just going to go up nice and easy up towards that medial side of the elbow. And I do that just to ensure that we kind of get up towards the lymph nodes that sit there. And I apply like so. With our fan, we have the benefit of the strips being, we're able to kind of go 1 centimeter apart. And the benefit of that is that we're able to increase the pressure differences between where the tape is and is not. So the fluid will flow towards the areas where the tape sits because that decompresses the area and provides more space for the kind of fluid to flow. And our last strip would just kind of be just like so. So we'll go around here and around. So we'll rub the tape to activate the adhesive after it's on there. And there is our application for how we're going to apply for our carpal tunnel. So we have our space in between the tape so that the fluid wants to move towards the tape, the area that the tape sits. And then that will be on there for 3, 4, 5, 6 days for whatever you determine the length of time you need between the taping treatments. So if we review our goals here, we went over how to use tape, or our Spidertech and cupping, and how it affects healing, as well as how we can apply it to each one of our clients to get our benefits. And if we think of providing the highest quality treatment to our clients, we're always trying to leave that lasting impression. Certainly, if we're dealing with pregnant ladies in their 3rd trimester, we want to do everything we can to help them. I mean, it's just these are the people that we want to make life easy for, and you're always kind of innately trying to help them as much as we can. And I think this is a great way that we can do that. We can combine 2 therapies that have great results. We can bring them together, and I think you get even greater results for our clients. And certainly with using our ProCut, we see that this becomes the highest quality treatment, and then their friends, anyone that they see throughout the day, they kind of can your work is on their body the entire day. So it's certainly going to bring up conversations about who they see, why they see them, what they're doing, how great it's helping. And it'd be a great calling card or business card for you as a therapist. let's conclude there, and let's jump into our Q&A.
Nick, you can turn on the thing on your, unmute yourself on your computer.
Okay.
And then just let them know, like, yeah, you can leave, you can ask your questions in the chat. Yeah, Nick, you just like say that you can ask your questions in the chat or whatever.
So we can...
Yeah, sorry, unmute yourself first.
All right. Raquel, see that, is there any sensation or tingling effect? Do you mean from the tape? Like what are you referencing there? No, the tape will give the sensation as if there's kind of constant. It's almost like someone's rubbing your arm the entire time it's on. It's rubbing the area that's there. It's kind of like hands that are kind of resting there. So a lot of times people will say that it feels like secure, or it feels like there's kind of a gentle rub, but certainly no tingling, numbness, or any kind of like sensation that way. So if anything, it kind of just feels like you're protected in the area where the tape is, and certainly just from that kind of that decompression, the lifting up of the tape, from that effect, that it should feel like there's some kind of relief from the tension that the swelling, that the fluid retention would cause. But in kind of more of a general way to answer that question, if when it's on the back or the shoulder or the knee, it's kind of just like there's hands on rubbing on the area of the body all the entire time you're using it. Will cupping work for trigger finger? I think you'll have to determine kind of the cause of the trigger finger. Certainly kind of decompressing, kind of lifting up over top of that tendon certainly would be a reasonable thing. If the trigger finger is causing any inflammation in the area, that would be positive as well. But yeah, I think that both the tape and the cupping can. I would certainly try that with for trigger finger, but you have to kind of know what you're trying to get out of it. If decompression is going to help, then I think then you'll be in business. I think thanks, Stephanie. I think so. I think the benefit with tape. The important thing is to know why you're applying it, and then know how to apply it to that area. So it's one of those things where when you're at your best, it's hard for tape to go significantly above your best. Where it is very, very reproducibly beneficial is when you're applying tape to areas that are injured, that are there's past injuries, that are swollen, and so knowing that the tape provides awareness, provides decompression. If you kind of take those principles, apply it to yourself or your clients, whatever their injury it may be, then I think that the tape will be excellent. I think you'll love it, and I think that people will be very surprised. People you work with, people that you work with will be very surprised how much benefit they get. And that's certainly how I got into it. I had a huge benefit on my shoulder. It was massive improvement with the shoulder, and so I bought in right away. I knew I could feel how beneficial this was, And so it wasn't just kind of hoping and praying that it worked. I knew it did. I could feel it. Then I went and did my best to understand how this possibly worked, with the science part of it, and then I was able to start kind of applying those principles to my clients. And so when you apply the right problem with the solution that tape provides or that cupping provides, then I think you're going to see massive benefits. Yeah, and I think if I don't want to jump over questions here, but if I love tape. I love tape. I use it with pregnancy and low back, and I mean that's going to be one place that there is massive amounts of research that show the benefits of it, both in terms of using it on the low back during pregnancy and on the stomach during pregnancy. Both these things, you see massive improvements for pregnant ladies, both during pregnancy and then postpartum in their recovery process to getting back to kind of their pre-pregnancy state, in terms of kind of like getting the fluid to move, kind of reactivating these muscles from all the stretching that happened through the tissue, and to kind of connect the brain with the ability to use these muscles again. There's just huge amount of benefit, and even in terms of kind of slimming up faster, it helps the kind of the fluid retention go away, and so even though you've just kind of allowed the fluid to move out, it visually you're able to and to objectively kind of reduce the waistline faster than if you didn't use tape. Is there any more questions? So the question being, how would you apply tape on a pregnant woman's stomach? We would use, the way that we have got we've seen the most success is we would use our low back ProCut, and we would apply it kind of underneath the belly button, in kind of like just above where the pubic hair is, and then wrap the 2 strips around the belly button, and the number 3 strips kind of around the side, and huge improvements. Like you get moms writing in and talking about how much this helped, people in tears. It's a pretty cool thing, to see. Always also, and so again, the feeling where like your just hands are resting on your stomach, providing kind of some support all through the day. I'll also always apply it to the low back at the same time. So just it helps the posture. So we kind of get the stimulation of the skin both in the front and the back, and you just see these great benefits. So I guess to sum that up, I would use 2 of the low back ProCuts, one in the front and one in the back. And we just kind of get constant awareness, constant stimulation through the anterior and posterior side of the for the mom. I think a cool thing to try too would be if you're a therapist, then try it yourself. Do the cupping on yourself, and then put some tape on there afterwards, after you finish, and do your own kind of case study. You have the one side without tape, one side with tape, and you kind of see how much quicker that the bruising goes away with the tape side. So you can kind of see the differences and the benefits with and without tape after your cupping treatments. And maybe that stimulates a research project where they actually combine these two things instead of separating them and comparing them against each other. Maybe we can kind of bring them all together, because the cool thing is these things don't compete with each other. Your cupping is done during your session. Your tape is put on after your session. There's no A or B. These things should be done together. I'll say the thing that you need to be cognitive of is if you're using kind of an oil-based cream underneath the cups, you need to make sure that you get rid of that cream before the tape goes on there. So whether you use rubbing alcohol or hand sanitizer, whatever it is, you need to make sure that the cream is gone before you apply the tape. Just that's one, like that and hair, body hair are really the two things that the adhesive in the Spidertech doesn't agree very well with. So just make sure you get the skin clean before applying the tape. Shall we do one last call for questions? Well, thank you, everyone. Oh, jumping on here. Nope, I would say no stretch. We've had the best results with applying it without stretch, which was counterintuitive for me. I figured you had to treat the tape like a brace, but not the case. It goes on there. It just provides kind of stimulation awareness. I think it kind of softens the transition from directional movement, but we had the best results when we didn't apply tape. We didn't apply stretch, and we did it in a position that whether you're kind of standing up late in pregnancy or if you're kind of lying on your back kind of earlier in pregnancy, the results were best without stretch, which again was counterintuitive to how I thought it would be going in, but it was also how we ensured that there was no issues in terms of the tape not stretching far enough, and because where you run into problems with kinesiology tape for the most part is either when you've stretched it too far, and now there's no more give, and so it's either the tape has to give or the skin does. We ended up with issues, or we end up with kind of a similar thing at the very ends. If we apply tension at the very ends of the tape, we have a spot where there's skin above it that has no tension. The tape is retracting backwards, if you can kind of envision that, because this tape is going down back towards my wrist, and so we get a kind of a traction burn through there. But if you can apply it with no tension kind of throughout and at the top, well, that's where we ensure we kind of cut out all of the adverse issues in terms of kind of skin irritation. Again, pretty important for our mamas in the third trimester, or really throughout pregnancy. Well, everyone, thank you for joining us today. I look forward to webinar number 5. We can keep building on numbers and our reach. And please reach out with any questions if things come up on how to apply or ideas, and we'd be happy to continue the conversation. But this has been tons of fun. I think we're doing great here. And I almost jumped the gun here. Yeah, so our kinesiology tape is completely latex free. And so if there's a latex allergy, then you'll be totally fine with our kinesiology tape. The other thing we have is we have a gentle line of tape that is completely even a different adhesive. It's more kind of a gel, water-based adhesive. It's designed for fragile, sensitive skin or areas of the body where the skin is more fragile, whether it's facial taping. Very popular there. We had some last couple of years, nurses wear it underneath their masks and doctors wear it underneath their masks to kind of prevent burn from there. Or if just your skin is just extra sensitive, it's designed for that. So I would try. I think our regular adhesive would be totally fine if it's a latex issue. But if there continues to be a sensitivity, then our gentle line of tape would be where I would send you, and it's going to give you every opportunity for kinesiology tape to work for you. If the gentle line of tape doesn't work, just because there is just too sensitive, then unfortunately I don't think tape is the right thing for that client. But that doesn't happen very often. And we'll go one last call for you're welcome. One last call for questions, guys. All right, well, that wraps things up. We're thrilled to have you and look forward to seeing you again soon for webinar number 5.